There lived a young nurse named Betty, and she was dating a young doctor named Sam in the same hospital. They both run the same shifts. They goes home together and comes to work together because they have the same duty roster. Although their relationship was private because they do not want it to affect their work and they don't want people to know about their relationship. But some people in the hospital noticed, but it was private to them. And Dr. Sam has promised to marry Nurse Betty, and they had dated themselves for 3.5 years. But something suddenly happened. Then Dr. Sam started acting different and started giving Betty some excuses. He do no longer wait for her anymore after closing from work. And then Nurse Betty was surprised. She started wondering what could have been the problem. She was wondering to know if she has offended him or not. And then later, Nurse Betty, she started seeing a group of people discussing about Dr. Sam, how he has started dating a new nurse that was employed in the hospital. But Nurse Betty trusted and respected Dr. Sam so much, and she did not believe that he could do something of that nature to her. And also, he was one of the senior doctors in the hospital. When she heard that, she was heartbroken because Dr. Sam does not call her anymore. He keeps on giving her one excuses to the other. And she did not see him anymore because Dr. Sam started avoiding her. And he went behind Nurse Betty's back to change the duty roster so that they will no longer be in the same duty together. Nurse Betty was so pained and felt betrayed. And the new nurse that was employed was size 14. And Dr. Sam initially told Nurse Betty that he does not like a fat person, that he likes Nurse Betty's shape. He likes someone that he can be able to carry and that can do all kinds of styles. And this nurse in question that Dr. Sam left Nurse Betty for was very fat, and Nurse Betty was more beautiful than her in all areas. And then Nurse Betty started asking herself some questions to know what could have made Dr. Sam to leave her for another, that she is even more beautiful than. She became so pained and betrayed because she realized that Dr. Sam has played with her emotions because he has promised to marry her. Nurse Betty became so angry and concluded in her heart that he cannot just break and end things with her and then go scot-free, that she must definitely make sure that Dr. Sam was sacked out from the hospital. She was determined to do anything within her power and her capacity to make sure that her mission was accomplished. She planned on doing something that would hurt him so that he could feel the same way she felt. So Dr. Sam was a pre-operative doctor who usually administer medication to patients before they will be sent to the theater for operation. And Dr. Sam was usually good in what he does. Later, the medication that Dr. Sam do administer to patients started becoming less effective because anytime he administered the medications, Nurse Betty would sneak in and alter the medication and then change the medication. She was always conscious in order not for people to see and suspect her. Some of the patients do not usually respond during the surgery. Many patients do not recover from their illness. And many people started complaining. And some of the patient relatives withdrew their patients and transferred them to another hospital. The hospital management started blaming Dr. Sam and questioning his practice because many patients stopped coming to the hospital for surgery. And Dr. Sam was trying to defend himself, but he did not know what went wrong because he knows within himself that he has been performing his duty in a proper way. So one day, Nurse Betsy wanted to alter another medication, and she was very conscious as usual. As she was already about to alter the medications, when she was done altering it, and she was about to leave, and a nurse caught her. Then she became so scared on how to explain to the nurse her reason for doing that, because they have been looking for the person that has been altering the medications. And the nurse started asking Nurse Betsy why she was altering the medication of the patient. She started questioning her if she wanted to harm the patient. But Nurse Betsy said to her that it was not the patient that was the target, but Dr. Sam. Then the other nurse said to Nurse Betsy that she was going to report her because she is endangering the life of the patient in the hospital. Then she started begging. She then explained to the other nurse on how she was dating Dr. Sam for 3.5 years and he promised to marry her, but later left her for another nurse that was newly employed. And then she has done everything possible and has given Dr. Sam different style, and that she has pleased him in all the ways a woman could please a man. And all of a sudden, he stopped picking her calls and left her for another. After this explanation, Nurse Betsy was surprised that the other nurse asked her if she knew the ex-girlfriend of Dr. Sam before they started dating. But Nurse Betsy said that she does not know his ex-girlfriend. And the other nurse said to her that she was the one. That the day Nurse Betsy was employed, that was the day Dr. Sam left her to date Nurse Betsy. That she was later diagnosed of high blood pressure because of the heartbreak she encountered from Dr. Sam. And that she just have to left it to go because relationships are full of ups and downs. Nurse Betsy replied was that she cannot let it go because the heartbreak has affected her work and that she could no longer sleep. She kept on altering and changing the patient's medications, and majority of the patients do not recover from their illnesses. On one fateful day, they brought a boy to the hospital for treatment, and the boy was a twin, and Dr. Sam also prescribed the boy's medications. And Nurse Betsy, she altered it. And she decided to give the little boy excess more than what the doctor prescribed, so that they administered the medication. The medication for the boy, it was too much for his age. Then the twin boy died because his body system was not able to carry it. So immediately the boy died. The twin of the boy, which was at home, died immediately. But Nurse Betsy became confused because it was the boy that took the medications and not the girl. And after the death of the twin girl, the girl started tormenting her. Nurse Betsy left the hospital and stopped working there. She then packed her things and left to another town. But the twin girl of the boy that died in the hospital keeps on following her everywhere she goes and keep on tormenting Nurse Betsy. Nurse Betsy keep on running for her life, and later she was hit by a car and she died a mysterious death, which no one knows the source of the death, because she kept on running and saying she's seeing someone, but nobody is seeing what she was seeing. And then later, Dr. Sam was infected with a deadly infectious disease, which later cost his life. The moral lesson of this story is that betrayal and seeking revenge only leads to more pain and suffering. Seeking revenge only causes a cycle of harm and ultimately bring about negative consequences. And it is important to prioritize one's health and well-being and make a responsible choice in relationship. And it is important to know that forgiveness is divine.